And Shawn, walk us through that initial visit, that patient that comes with BPH, URI symptoms. What do you do on that initial visit? And has it changed? I mean,
It
you mentioned
has.
being more proactive. What have you
Absolutely.
done different to change that?
The thing that NeoTract and UroLift did that I think a lot of the other types of interventions have followed suit is they really hammered IPSS, or the symptom score index. And they felt like that was important to really search for the patients. And I think that was manifest in my practice too. I was not consistent with IPSS. I was not consistent with, really asking the patients about their avoiding dysfunction. And this made this very efficient. And the fact that when you walk into the room and you have this IPSS symptom score, you know what's going on, because there is a phenomenon of not wanting to disappoint the physician. And so you go to the doctor, you've had BPH, and okay, Mr. Smith, how are you doing? Oh, I'm doing fine, doctor. And come to find out, you've had him on Flomax for 10 years, and he's up 4 times a night. And, he's bathroom shop hunting everywhere he's outside, and he's not happy. But he's not comfortable in telling you in every situation that, hey, this is failing for me. And what is failing? Is this okay? Is this just me getting old? Am I expected? Everyone says when you get old, this happens. I guess this is just part of aging, so I'll just live with it. And so I think that IPSS score was somewhat liberating for patients to kind of write down what they're really dealing with. And whether they felt like that was good or bad was not really the point. The point is, that that's bad. As a provider that they've been on tamsulosin from their primary care doctor. They come to your office and they have an IPSS symptom score of 24. They're up 3 times a night. That's their bladder crying for help. And so that is, I think, one of the most important things that NeoTract and Teleflex brought into the arena was, asking your patients to be honest with you about their symptoms. And I saw that in my own practice. When I really adopted that, I was amazed and embarrassed that the number of patients that I had had on medical management, okay, everything looks good, your PSA is 2.1, I'll refill your Flomax, we'll see you next year. They weren't doing well. I think the first several months of really adopting that, it was eye-opening. It really was. So that's a long-winded way of saying any male patient that comes to my office, and I'm in a large urology group. We've got, I think, about 17 or 18 partners. Fortunately, we've adopted that across the board. So if you're a male and you're over the age of 40, whether you're here to talk to me about a vasectomy, or you've got a kidney stone or ED or whatever your problem is, we're going to get an IPSS symptom score, because that lets us know where you are. In our community, a lot of the primary care doctors initiate treatment with medications. And so you'll see a wide range of guys who are either they're on tamsulosin or their primary doctor starts them on tadalafil. We have some that put them on combination therapy. And so oftentimes the patient that comes to my office is someone who has already been on medications, who has already found that this was not helping them. And so they come to my doorstep. I do the IPSS symptom score. I also like to do a post-void residual. When I walk into the room and I know that that patient's already been on medications and their IPSS score is bothersome or their quality of life is not satisfied, then that's an easy conversation for me to take that time with them and not talk about asking them 10 questions about their symptoms, but taking that time and talking to them about what are some of the other options. And more importantly, what are the options in diagnostics? What are you a candidate for? We can do better than we are right now. And so that's the initial step, is the IPSS, a post-void residual, obviously reviewing the meds and having the conversation about where they are and what it means. And that kind of gets back to the, you and I talked about bladder health. Urinary symptoms are bladder related, whether they're a result of prostate enlargement or whether they are bladder initiated or a combination of both. And that's our job to really unearth that. And it's definitely the bladder waving the white flag. I use this analogy on occasion to some patients, especially some of my younger patients. if you went to a cardiologist and he said, hey, listen, you've got some blockage on your coronary. You're doing okay now, but we'll just hold tight until you have a myocardial infarction, and then we'll talk about dealing with the blockage. And, I think cardiac muscle, bladder muscle, similar in certain senses that they can't be rehabilitated. And so kind of throwing that analogy out there that, you don't need to do this for another 20, 30 years of your life. Let's deal with this obstruction and save the bladder.
Teleflex is the paid commercial sponsor of this podcast and is not responsible for the content beyond this paid acknowledgement. The UroLift system is indicated for the treatment of symptoms of an enlarged prostate up to 100 cc in men 45 years or older. As with any medical procedure, individual results may vary. Most common side effects are temporary and include hematuria, dysuria, micturition urgency, pelvic pain, and urge incontinence. Rare side effects, including bleeding and infection, may lead to a serious outcome and may require intervention. Consult the instructions for use for a complete listing of indications, contraindications, warnings, precautions, and potential adverse events.